Okay, Matthew Holt. So Noom now has a mental health offering called Noom Mood. Meanwhile, Headspace has partnered up with Waze and is offering meditation while you drive, which is
I crashed. I was up.
Stop it. And then this is the most bizarre thing I've ever seen. We need to start a press release hall of fame for some of the crazy press releases that come out. This one, Dario Health announces a major partnership with a major national health plan, but doesn't say who it is. It can only be the October 15th episode of Health in 2.00.
So Jess, I'm very keen to hear about the potential interviews with potential CEOs that you might be doing at some point. What's going on?
Well, this is like that, in the spirit of the Dario Health press release, where Erez Rafael, the CEO, needs to tell me what's going on, I think. But yeah, I'm going to follow along with this. I'm going to announce that I am very pleased to say that I'm going to be revealing some very big interviews with some health innovation CEOs on a channel where there are other videos. And in addition to that, I'm going to have some additional interviews with other health innovation CEOs that are going to be coming out shortly thereafter.
So Dario's stock went up 20% on that news. And I'm selling your stock right now because it's gone up 20%.
Woo!
Okay.
Thanks to the press release that's sketchy on the details. I'm your girl.
By the way, there was actually some really big news today. So should we just go do that?
Let's do the big news.
Okay. And
oh my goodness, Walgreens launches Walgreens Health, acquires a controlling stake of VillageMD, and acquires a majority stake of CareCentrix. Matthew Holt, what is going on at Walgreens?
So Walgreens has already got a deal with VillageMD. Tim Barry was at our conference, What's Next Healthcare. And he basically said that they have to open 500 clinics in, it's like 2 a week for the next 3 years or something. So extraordinary, faster than Starbucks opened at its fastest rate. Walgreens has obviously made the bet. It's been losing kind of to CVS and Walmart over the years. Stock price is way down on its high. Sadly, I obviously own some. And now they're saying they're getting really into healthcare. So VillageMD is sort of capitated managed primary care, which is not only retail primary care, but also managed primary care for Medicare and Medicaid. CareCentrix is sort of in-home care management, post-acute management platform. So they're going all in, but they are going to float this all off later on an IPO next year. So it's a bit curious, but yeah. See
what happens. All right, Intelerad, they acquire Ambra Health for $250 million. Or sorry,
Ambra Health. It used to be called Dicom Grid. Ambra Health, Intelerad been growing fast, private equity backed. Ambra, used to be called Dicom Grid, moves data and images around kind of in the interoperability world. Good thing with patients, I think.
All right, Mindbody acquires ClassPass. Diabolical.
You know about this company. This is like
I know all about this. So Mindbody is basically like the EMR for fitness studios. It's like their booking platform. And ClassPass is like this unique business model where you can buy a membership to ClassPass and go visit all those studios at discounted rates. The combination of these two things, brutal. All right, what about Sprinter Health? They get $33 million in a Series A led by Andreessen.
Yeah, I had a bit of a back and forth, well, not back and forth, a thing on the old Twitters about this. This is curious to me, right? Because this is the Twitter, on Twitter.
The old Twitters.
On the interwebs, on the Twitters.
Hey.
Well, here's the deal. So they are going to send phlebotomists to your house to draw blood or do a COVID test. Right now, clearly there's something going on behind the scenes because what they currently say as the business model doesn't make any sense. They already had 4.8 million from General Catalyst, and it basically, you can buy it as a consumer for cash, but you're paying someone to come and draw blood, whereas instead you just go to, you go to LabCorp or go to the hospital, go to the doctor, they draw blood for you, and it gets wrapped into the cost. This is just for the blood draw part, and that's $79. Or they will come and do a COVID test for you in your house. That's $99, and you can do one online. I think I found out was $65 for two. So it doesn't make a lot of sense to me as to the current business model. I suspect what they're doing somewhere in the background of all this, because the Andreessen folks aren't stupid. They must have some way they're going to aggregate demand, or they're going to get to patients who they couldn't otherwise get to, or there's something going on here, but I don't know what it is. But it's 33 million the question for me is, right, that the valuation of this company must already be well north of 100 million. How are they going to get that to be a $1 billion company? And I don't know, we'll sign up. But
you don't think there's an opportunity there? I mean, like you have to go to like a Quest Diagnostics to get your blood drawn sometime if it's independent from the doctor's appointment. I've had to do that several times, and those are not conveniently located. They're like in the craziest.
Are you prepared to pay $80 to have someone come to your house instead?
I think honestly that the last time I had to do that, I would have.
Oh, well, maybe then
the convenience thing. This was back when I lived in Los Angeles. I sat in traffic. It was like a total hassle to get there. And then you had to sit in the waiting room and wait.
But that's a tiny market. People who are that inconvenienced by it will pay extra. That can't be what they're going for. Maybe
if you're elderly or if you're incapacitated.
The only question is it like, can it wrap into kind of that home thing like dispatch or one of those other things going to the home where it can be more than this? But then why wouldn't you just have those guys? There
are all sorts of
there is another shoe drop
to the doctor for a blood draw, and it is the biggest hassle. And it's like this to me, I don't know. No.
I've got the answer. We build a machine, a small machine in a box. We get a tiny finger prick. We put that box into everybody's house.
Yes.
The thing into the box. We put the thing into the box, and it gives you every single test you can imagine. And then we sell that company for $9 billion.
It sounds a lot like Theranos, but I think that it's different enough where nobody's going to catch on.
We're there. We're good.
We can get it covered by a major national health plan, if only.
I can wear a blonde wig. It'd be great. Oh my God. The joke is, right, for the Theranos trial, they've had, right, the CEO of Safeway and the person with Walgreens. There were people in Safeways and Walgreens who kept on saying, no one has checked this damn thing. And didn't matter. They just got ignored by their CEOs who now appearing for the prosecution saying, well, we gave all this money. We thought it was supposed to. We were told it worked. It didn't work. That trial is
this is going to have implications for all of our health tech company and biotech company friends in ways that
you'd think so, but people are raising money like crazy. So who knows?
Yeah, but look at some of this stuff. I mean, a lot of this is like innovative business model, or a lot of it is like, you know, digital therapeutics, digital health, telehealth, virtual care. Like it's not an entirely new.
Well, hopefully, if there's a good outcome to the Theranos thing, which I'm not sure is that people have to show that shit actually works. can't just completely fake it. But,
I love that that's the good thing that comes out. Like that should have been like in place before.
That hasn't been in place in any aspect of healthcare for the last 200 years. Why should it be doing that?
Yeah, prove this shit actually works. I love it. All right. This is the importance of demos. One day you can wax philosophical, on that. Or maybe you can do it on Twitter. Follow him over there at BoltyBoy. I'm at Justamassa. We will be at Health next, tweeting from there, probably doing this cute little show together in person. Maybe we'll get some special guests. We'll take requests. You can ping us. So sign up for the email newsletter too at thehealthcareblog.com and make sure you do not miss any of that exciting coverage or the WTF Health interviews I've got or the great pieces that are coming out from the blog throughout the week. Those emails get delivered directly to your inbox on the weekend, so you can enjoy them over a coffee and croissant.
Well, people aren't living well in your world.
People without kids. That's what we do when you don't have kids. On Saturday, we wake up at 10 and we drink coffee and
I remember those days.
And read the healthcare blog e-newsletter. And with that, I'll leave you. See you guys soon. Bye.